Imagine a hidden danger growing in your gut without you noticing until it's too late. That's colon cancer. However, it's also one of the easiest cancers to prevent. In the beginning, colon cancer usually doesn't show any signs, but as it gets worse, it can cause serious problems. Let's look at how it impacts your body and why it's so important to catch it early. 1. Abdominal discomfort. Abdominal discomfort, including pain and cramps, is frequently associated with colon cancer, although it may also stem from various other sources. This sensation can manifest as a consistent ache or cramping sensation in the abdominal region, ranging from mild to severe. Typically, as the tumor grows and obstructs or narrows the intestine, these symptoms arise. Such obstruction can result in the accumulation of stool and gas, leading to discomfort and pain. Additional symptoms might include bloating or a persistent feeling of fullness, even after consuming small quantities of food. It's important to recognize that abdominal discomfort and cramps can be attributed to a range of factors beyond colon cancer, such as indigestion, gas, or constipation. Nonetheless, if you encounter persistent or severe abdominal discomfort, particularly alongside other symptoms like alterations in bowel habits or unexplained weight loss, consulting a doctor is essential. Diagnostic tests like CT scans or colonoscopies can help identify the underlying cause of your symptoms. Early detection of colon cancer can significantly enhance treatment outcomes, underscoring the importance of addressing persistent abdominal discomfort or cramps promptly. If you're worried about your symptoms, seeking medical guidance without delay is highly recommended. 2. Blood in the stool. Blood in stool can vary in appearance. It may appear bright red and coat the stool or mix with it, or it might be dark and adhesive, indicating bleeding from higher up in the digestive tract. Bleeding associated with colon cancer can be intermittent, sometimes not visible to the naked eye. Even if blood isn't visibly present, tests can reveal its presence. However, not all cases of colon cancer involve bleeding, so the absence of visible blood doesn't rule out the possibility of the condition. If you observe blood in your stool or on toilet paper, it's crucial to consult a doctor. Diagnostic procedures like colonoscopies can identify the cause of bleeding and recommend appropriate treatment. Ignoring rectal bleeding is unwise. Early detection of colon cancer through medical intervention can significantly improve prognosis. Prioritizing your health and seeking medical attention promptly upon noticing concerning symptoms is paramount. 3. Unexplained weight loss. Unexplained weight loss refers to a significant reduction in body weight without deliberate actions like changes in diet or exercise. While weight loss is often viewed positively, unexplained weight loss can signal an underlying health issue, including colon cancer. In colon cancer cases, weight loss typically occurs as the tumor grows and impacts digestive function. This growth may hinder the body's ability to absorb nutrients properly, leading to weight loss. Moreover, the body may utilize muscle tissue and fat stores for energy, exacerbating the weight loss. It's crucial to take note of unexplained weight loss, particularly if it's substantial or rapid. Losing over 5% of body weight within a few months without intent may indicate an underlying problem requiring medical attention. However, unexplained weight loss can stem from various causes beyond colon cancer, such as thyroid issues, diabetes, or depression. Hence, consulting a healthcare professional upon experiencing unexplained weight loss is essential to identify the root cause and receive appropriate care. A doctor may conduct a comprehensive evaluation, review medical history, and order tests like blood tests or imaging studies to ascertain the cause of weight loss. Early detection of colon cancer can significantly enhance treatment outcomes, underscoring the importance of addressing unexplained weight loss and other concerning symptoms promptly. Fatigue and weakness. Fatigue and weakness often manifest as cancer progresses, affecting the body's overall functioning. The tumor's disruption of normal bodily processes can lead to these symptoms. Moreover, as the cancer enlarges, it may induce internal bleeding, causing anemia, a condition marked by a low red blood cell count. Anemia diminishes the blood's oxygen-carrying capacity, resulting in fatigue and weakness. Additionally, the body's immune response to cancer cells can deplete energy levels, contributing to fatigue. The emotional and psychological strain of coping with cancer diagnosis and treatment can further exacerbate feelings of fatigue and weakness. It's crucial to heed persistent fatigue and weakness, especially if they impede daily activities and fail to improve with rest. While these symptoms can stem from various causes beyond colon cancer, such as sleep disturbances, stress, or medication side effects, they warrant attention, particularly when accompanied by other symptoms. If you experience ongoing fatigue and weakness, consulting a healthcare provider is vital. They can assess your symptoms, conduct necessary tests like blood tests for anemia or imaging studies for cancer detection, and recommend appropriate treatment. Addressing the underlying cause of fatigue and weakness, whether colon cancer or another condition, is essential for enhancing overall well-being and quality of life. 5. Anemia. Colon cancer can lead to chronic blood loss due to slow bleeding from the tumor or growth in the colon or rectum. This prolonged blood loss can gradually decrease iron levels in the body, eventually causing iron deficiency anemia. The bleeding may not always be apparent since it occurs gradually over time in small amounts, resulting in subtle symptoms that are easily missed. Symptoms of iron deficiency anemia include fatigue, weakness, pale skin, shortness of breath, dizziness, and cold extremities. These symptoms arise because the body's cells and tissues receive inadequate oxygen due to the decreased number of red blood cells. It's important to recognize that iron deficiency anemia can develop gradually, and its symptoms may be nonspecific or attributed to other factors. Nonetheless, if left untreated, iron deficiency anemia can lead to serious complications and negatively affect overall health and quality of life. If you experience symptoms of iron deficiency anemia, particularly alongside other indications of colon cancer, it's crucial to consult a healthcare provider for further assessment. Diagnostic tests, such as blood tests to measure iron levels and a complete blood count, CBC, to evaluate red blood cell counts, can confirm the presence of anemia and identify its underlying cause. Moreover, if iron deficiency anemia is suspected to be related to colon cancer, additional evaluation with imaging studies like a colonoscopy or gastrointestinal tract imaging may be recommended. These tests enable healthcare providers to visualize the colon and rectum's interior and detect any abnormalities, such as tumors or polyps, causing bleeding and contributing to iron deficiency anemia. 6. Change in bowel habits. A persistent alteration in bowel habits lasting beyond a few days warrants attention, especially if no obvious causes like dietary adjustments or medication changes are evident. Heightened vigilance is crucial for recognizing changes such as increased bowel movement frequency, persistent constipation, or narrower stools, which could signify early stages of colon cancer. Furthermore, abdominal discomfort or pain accompanying alterations in bowel habits necessitates prompt medical attention. Early detection significantly enhances the treatability of colon cancer. However, advanced stages pose greater challenges. Hence, remaining vigilant regarding bowel habit alterations and promptly discussing them with a healthcare provider is vital for timely diagnosis and appropriate management. Do not delay in reporting any changes in bowel habits, as early intervention can be life-saving. 7. Nausea and vomiting. In the context of colon cancer, nausea and vomiting can arise from several factors associated with the disease and its impact on the body. For instance, as a tumor develops in the colon or rectum, it may obstruct the normal passage of digestive contents, leading to bowel obstruction. This blockage can result in the accumulation of food, fluids, and gas in the intestines, causing symptoms like abdominal discomfort, bloating, and nausea. Additionally, nausea and vomiting linked to colon cancer may be induced by other factors, such as chemotherapy or radiation therapy administered to manage the disease. These treatments often trigger gastrointestinal side effects by affecting healthy cells in the digestive tract. It is imperative to seek immediate medical attention to determine the underlying cause of nausea and vomiting and ensure appropriate treatment. Healthcare providers may conduct diagnostic tests such as imaging studies or endoscopic procedures to assess the gastrointestinal tract and identify any abnormalities like tumors or obstructions contributing to the symptoms. While nausea and vomiting are not exclusive to colon cancer and can arise from various other conditions, persistent occurrence, particularly alongside other signs of colon cancer, warrants attention and should not be disregarded. 8. Rectal bleeding. Persistent rectal bleeding refers to the ongoing passage of blood from the rectum, often noticed in stool or on toilet paper following bowel movements. While various factors like hemorrhoids or anal fissures can cause rectal bleeding, it can also signal more serious conditions like colon cancer. In cases related to colon cancer, rectal bleeding typically stems from a tumor in the colon or rectum. The blood may appear bright red, indicating recent bleeding from the lower digestive tract, or darker if originating higher up in the digestive system. Importantly, not all colon cancers lead to rectal bleeding, and its absence does not rule out cancer. Persistent rectal bleeding necessitates assessment by a healthcare professional, as it could signify an underlying health concern requiring prompt attention. Although occasional rectal bleeding may not be alarming, persistent or symptomatic bleeding warrants investigation. In the context of colon cancer, persistent rectal bleeding may coincide with other symptoms like changes in bowel habits, abdominal pain, or unexplained weight loss, which should prompt further evaluation. If you enjoyed the video and found it informative, please consider giving it a thumbs up and feel free to share it with your loved ones. If you're new to our channel, don't forget to subscribe to support our growth and hit the notification bell so you don't miss out on our next video. We're curious to hear from you. Were you aware of 8 warning signs of colon cancer? Share your thoughts in the comments below. Before you go, you may also find some other helpful videos popping up on your screen. Feel free to click on any of them, or even better, watch both to continue your knowledge journey with us. Thank you so much for watching. See you in the next video. Stay healthy and bye.